It's not surprising. Nigeria is a cholera endemic area.
Hi guys, my name is Deborah Ewuru. I am a medical laboratory scientist. Don't ask me how I got this doctor to be on this show today, but I'm glad I have someone here that we can talk to, and I'm going to stand as the public to ask certain questions about cholera, which is the trending medical issue. I don't know if using the word trending makes a lot of sense right now, but yeah. So this is Dr. Patrick Ewuru. He's a doctor in the Department of Pathology in the University of Calabar. But I'll allow him, University of Calabar Teaching Hospital rather, I'll allow him to do a brief introduction of himself, then I'll ask him certain questions. So over to you, Dr. Patrick.
Okay, thank you, viewers. I am Dr. Iwuru Patrick, uh, a resident pathologist in the University of Calabar Teaching Hospital. And that means I am training to become a, a consultant in pathology. Pathology is a broad area, is a very interesting and appealing area these days. And it also covers aspects of infectious disease. And infectious disease is one of those areas that attract me, an area I'm thinking that I will in future specialize in. And cholera is one of such infectious diseases, and it's quite an interesting topic to discuss. It's long we've had is sporadic cholera incidences have been here and there. We've had sporadic cases of cholera here and there, but an outbreak in Lagos, I think it has been a while we talked about an outbreak and an epidemic for that matter. It is not surprising. Nigeria is a cholera endemic area, an area where you have significant number of reported causes of cholera per year, and cholera used to be one of those reportable diseases before. So we are going to be discussing a topic that is cogent, that is revealing, that is revelatory, and that will benefit you, our listening viewers.
Yeah, thank you very much, Dr. Patrick. You see, I brought quality and stock to this podcast today. So it's not just a random person coming to talk to you about cholera. It's someone that is experienced talking to you about what it is. So there might about cholera right now out there. One of these days, a colleague of mine wore a nose mask. I don't wore a nose mask, and my boss was like, do you think cholera can be gotten like Ebola or one of these diseases that we have? Why are you wearing a nose mask and all that? So I would like to ask you, is cholera a disease that can be gotten from just through inhalation or through touching somebody? Can you contract it by just touching somebody that has it, or how else do we?
Thank you very much. Cholera is a serious disease, no doubt about it, and it's quite frightening. Patients who have cholera can lose you imagine it can lose up to 20 liters of fluid a day simply from diarrhea losses, and death often is not very far off.
Yeah.
So your colleague at work was acting reasonably, but
do you think she was doing too much? Can you actually get it from just inhaling?
No, cholera is not spread via aerosols. It's not spread via coughing, talking. Somebody does not spread cholera through those means. Cholera is an intestinal disease, and it is spread by usually by poor hygiene, especially what you do with your hands, where you place your hands, what you touch with your hands, when you go to the latrine, what you touch other people have touched. We call that in epidemiology we call that fecal oral spread of disease. It is spread
fecal oral, that's feces and then your mouth.
Feces and the mouth. So fecal oral spread and maybe contaminated food and water are primary modes of spread for cholera. So cholera is not transmitted via through touching, coughing, touching, and the rest of it. But you should practice good hand hygiene always, and especially now. Washing your hands, especially after you do anything, is
paramount.
Yes, it's basic. It's foundational now.
Yeah. So in summary, what you are saying is cholera can be gotten through contaminated food and water.
Yes.
And then probably, I read an article that was saying you literally have to flush your feces very well and wash your hand. And if you have to practice open defecation, you should ensure that you bury those.
Well, cholera thrives in such environments.
Okay.
Actually, cholera thrives in regions of the world that are relatively underdeveloped, that
Okay.
are in the developing world, because facilities for good hygiene, facilities for sanitation, they are not available. In the developed world, you only see such conditions are only ripe when there's perhaps um, uh, some upheaval. Maybe
Yeah.
there's war with
Okay.
displacement of large numbers of
The
people.
people. Yeah.
For example, the war occurring between Israel and Gaza,
Okay.
Israel and Gaza currently,
Yeah.
or it can also be when you have natural disasters. Natural
Okay.
disasters can displace many people and put people in dire situations, in extreme
Situations.
situations where cholera, and in such situations, when you have a primary source of infection. You have a source of infection, a source of the initial infection. You can rapidly have an epidemic. So cholera thrives in such regions of the world as we are in. Nigeria is still a struggling country.
Yeah.
We are the third world nation by many. That's why there are rich oil resources
Yeah.
and the trillions and billions we talk about in terms of we're still a developing country.
Okay. I want to ask a very tricky question now. I know this can be this is not exactly supposed to be medically
Oriented.
oriented, but I think it has something to play. Do you think the current economic condition has a role to play in the current rise in number and occurrences of the cholera disease case? Why I'm asking this is because in a country like Nigeria, I don't think that we're supposed to be suffering or going through things like cholera
As
in
bad.
2024. Yeah.
No, no, no.
So, do you think because as a result of absence of food or bad economy, you think the people in the lower class have started exposing themselves to certain
Well,
condition or certain kinds of
the
food?
epidemiology of disease has
Okay.
been for a very long time affected by social strata,
Okay.
the stratification of of of, um, of society into several groups based
Okay.
on wealth, based on the availability of resources, and so on.
Okay.
Cholera is no less one of them, one of those
Okay.
diseases. Like I tell you, where sanitation is poor, where basic access to water and soap and other things are not available,
Yeah.
cholera spreads easily,
Okay.
and there are more chances of fatalities. So, and present economic condition, um, the present economic condition is no news. You only have to be a doctor in a hospital or in a facility where you see patients every day to know that people are indigent, they are very
Yeah.
poor, and
Yeah.
poverty is responsible for a
A lot of
huge,
things.
significant number of deaths from
Yeah.
diseases that were that were otherwise treatable. No
Okay.
doubt the economic conditions are biting, but I don't think that um,
It
um,
has a large role to
uh,
play in the spread of the
it
disease
has a role.
currently.
It has a chief role.
Okay.
It has a chief role. It has a most significant
Oh, so
role.
you're saying it has a significant
Yes, it
role
has
to
a
play?
significant. It has a
Okay.
significant role in mortalities that have arisen from several diseases,
Okay.
including cholera.
Okay.
So yes, so the economic situation, no doubt, will be a big contributor to
So,
the difficulty we have in managing cholera at this time. Actually, cholera is a money-intensive disease to treat because
okay.
you need so much fluid. You need just to load that patient with fluid.
And I'm asking a question. What are the symptoms that cholera portrays itself as? Like at home, what are the symptoms like the basic symptoms of cholera?
Okay, the principal symptom of cholera
Mm,
is watery diarrhea. An
okay.
acute or severe episode of cholera will present
Okay.
with diarrhea.
Okay.
Diarrhea is loose watery stools that the patient
Okay.
experiences because of because of the high water content of the stools,
Okay.
yeah, and malabsorption. There's something we call malabsorption occurring because of the presence of the organism
In the
multiplying the gastrointestinal tract and
okay.
producing its toxins. And the stool adopts. Well, the stool looks like
Rice.
rice water. You
Okay.
have characteristics rice water stool.
Okay.
Yes. So
Like
the
when you just
stools,
wash
yes,
rice, the
the stools,
starchy feel,
yes, the
starchy
color
color.
and
Yeah.
feel of that starchy top,
Yeah.
what you decant from the top of the rice
Okay.
when you wash a bowl of rice. So stooling is the primary thing of diarrhea, and the stool could be suggestive of what is causing this diarrhea. And there's nothing quite like a severe attack of cholera in terms
Okay.
of fluid loss. You can just be pouring, and and you can lose up to 20 liters of fluid a day.
So is the dehydration that kills?
The dehydration kills. Apart from the dehydration killing, they're resulting in shock.
Okay.
So shock is a physiologic state where there's no more that because all the fluid that is produced, the fluid is gotten from somewhere. The fluid that is
Okay.
lost from the body is a filtrate of blood.
Okay.
So eventually, blood volume will be affected. The patient can die from shock.
Okay.
Shock secondary to contraction of blood volume. So apart from dehydration killing, you can also have electrolyte losses. Patient can also die from loss of valuable sodium,
Most
potassium.
likely as a result of vomiting.
Yes, most of the time, most likely as a result of a combination of stooling and vomiting, which was present in the disease. Cholera is a gastrointestinal infection.
Okay.
Completely.
Okay.
The organism doesn't go to any other part of the body, so it doesn't spread to other regions of the body, but it kills because of the extent of diarrhea and the extent of volume loss, the extent of diarrhea that you can have following a cholera attack. So diarrhea, dehydration, shock, and death is often the
outcome of cholera.
Is one outcome, but there are cases of cholera where the disease is milder.
Okay.
Cholera is not always a severe disease
that leads to death.
But in a significant number of cases, cholera has can be a fatal disease. Let me put it that way. Cholera can be a fatal disease, and severe expressions of the disease can produce fatalities in a very short in a matter of hours.
Okay.
Yeah.
So in other words, what would be your general since we have established the fact that cholera is not gotten through inhalation, so thank God it might not lead to a place where they'll say stay at home and all of that. A situation like that in the likes of Ebola and all of the pandemics we've had in the past. But what's like your average advice to the general public right now on what to do to prevent?
I would advise them not to panic because the cholera burden in the world, we've had a low incidence of cholera relatively over the years. As the country has been developing economically, as the economic climates are improving, as people are getting
more educated,
and informed and are having access to clean water and other and other basic necessities. Some of these diseases they have been controlled, and they shouldn't panic. Cholera is a disease that is acquired majorly because we eat carelessly, we touch surfaces carelessly, we don't wash our hands well enough, and we shake hands. We do all that. We can acquire contagion. We can acquire the organism through that, and we eat and through contaminated food and water, like I highlighted earlier. Through these means and through these modalities, you can acquire the infection. And once you acquire the infection, many times the infection may not lead to death. It may lead to diarrhea, but a controlled level of diarrhea. But in severe cases, it will lead to profound diarrhea and death. But in other cases, it will lead to a more controlled episode of diarrhea. So there are mild cases of cholera. There are severe cases of cholera. Cholera is not. It should not frighten us now that there is an outbreak of cholera occurring. This is bound to happen.
Once we play our parts. Yes. So, Dr. Patrick, I would assume that in 2024 we'll not be having issues like cholera, like Nigeria would not. So, but you were trying to say that.
I was trying to say cholera is still very much with us.
Okay.
2022 estimates say there were about 479,000 infections.
Wow.
Globally. That is all around the world. 479,000 infections, cholera infections, and as many as 2,344 deaths in 2022.
And that's not just Nigeria.
Yes, that's not just Nigeria. 44 countries affected. Deaths amounted up to 409,000 reported cases of cholera, plus the many unreported cases, because these are often the poorest nations of the world, where reporting tends to be not done. We're underreporting.
Because of social, because of the impact on the country and all.
Exactly.
Yeah. So many countries tend to hide the figures.
Are a lot higher.
Yeah.
So the incidence of cholera is quite reasonable.
Wow.
But cholera is a relatively mild disease most of the time.
Okay.
It is only in certain people that you have a severe expression of disease that
Does it
threatens
have to do
life.
something with their immune system or
No, it doesn't have
something?
to do with the immune system, and it doesn't have to do with the
Or
immune
it has to
system.
do with
It
the
has to it
disease?
has to do with the virulence of the organism. It has to do with
Okay.
the characteristics of the organism that infects
Infected
that
the
person.
person. Okay.
And the virulence characteristics of the is a bacterium, a
Yeah.
complex organism,
Yeah.
and it can display
In different
yes,
ways.
yeah, they can have contrasting. They can have you can have a mild infection.
Okay. Are they
But
asymptomatic carriers of
no, they are not
cholera?
asymptomatic. We don't have human resource. They are not asymptomatic carriers of cholera.
Okay, I'd like
So don't be
to tell
afraid.
you guys what asymptomatic carriers are people who carry the bacteria but do not portray it in any form. So they just go about their normal life. You don't see symptoms or
No,
anything
they are not asymptomatic carriers
of
of cholera
cholera
disease. Cholera does not
portraying in that
yes
manner.
does not present in
Present
that
itself in
form.
that manner. So
Yes.
are they also carriers? Is it also a bacteria? Like, let's say sometimes when people go through things like chickenpox and measles, they believe that once you have gotten it, you can
You
never
don't
get it
get it
again.
again.
So is cholera one of those bacterial quote
Ye-
where once you have gotten it, you are prone not to ever
Once you've got it, you can have protection
your body has
yes
developed some
against
form
other
of
serogroups. That particular serogroup and maybe some other serogroup, but it doesn't mean you are
you're
immunologically
exempted.
yes exempted from a recurrent infection. You are
Okay.
not immunologically excluded from a recurrent infection. You can have a subsequent infection. There are
Wow.
different serogroups, but some level of immunological resistance develops,
Okay.
but it's not to the extent that you say I've got it. You can always get it again, and this time get a severe form of the disease. So it's best you take
Take
universal
precautions.
precautions.
Yeah.
Yeah.
So make I speak am for English wetin Dr. Patrick dey try to talk. E dey talk say cholera na fecal oral disease, meaning say anything wey enter your mouth you just need to dey very careful. So e mean say make you dey wash your hand regularly. If you go toilet, make you ensure say you flush your toilet well well. If you wan chop fruit, make you ensure say you wash am with clean water or you peel the back of the fruit well well. So because anything wey dey go into your mouth, you need to dey careful. For those people wey dey chop anyhow, wey dey buy fruits, dey buy food, public food, make you dey careful this period. Make you no go carry your hand and your money take buy wahala. So na wetin dey try to talk. So in summary, Dr. Patrick, I'd just like for you to round up this video by saying one or two things to the general public about cholera and how they should protect themselves, and maybe one word for your
Okay.
for the
Yes.
public.
One word I would say: we shouldn't panic. And it's a motto I personally live.
That's more than a word, by the way.
Yes. Yes. Panic often doesn't
Solve
get
any
you anywhere.
problem.
Doesn't
Yeah.
really solve the problem. A cool head, many times you can think clearly and resolve matters.
Okay.
There's no need to panic. There's a cholera outbreak.
Okay.
This is a cholera endemic region of the world. It might seem that there is now an epidemic of
Yeah.
cholera, but we
We can have it under control.
yes, and we can largely control it.
By proper hygiene.
Yes, community engagement is very key in managing outbreaks.
Yeah.
So we need public health services to be up and doing.
Yeah.
But it can, and when you have very severe expressions of disease, it's not also a death sentence. But please, it is better to take measures not to have the disease at all. Cholera is a treatable disease, but it is a disease that can be fatal. So I would suggest that the little advice we have given in terms of hygiene tips should be taken in terms of safe eating, in terms of good washing of the hands. We cannot overemphasize you washing your hands.
Yeah.
Wash your hands almost all the time,
Yeah.
and you'll be able to stop. You'll be able to prevent and avoid
Cholera.
infections. Yes, cholera.
So thank you for joining us today. Hope you learned a lot. This was really an educative session with Dr. Patrick Ewuru. Like I said earlier on, he is a pathologist. He is a doctor in the Department of Pathology,
Yes,
University of Calabar Teaching Hospital. So this is a very experienced person talking to you. So we'll be having more of this subsequently with different doctors, different medical professionals and the like, talking to you about key topics that are affecting us as a nation and us as a continent in general. In fact, the world generally, because this is like an open space. So please share this video, like, comment, subscribe, ask your questions, and if we can answer them, we'll answer them in the next video.
Thank you.
Thank you.
Thank you.